One of the biggest misconceptions that I feel is online is that women feel that there's just the perfect type of HRT, that there's one form that's better than the other. So I want to go deep on this and really give you the truth as to which is the best one. If you're new to me, my name is Sherry, certified in menopause health and hormone optimization, and I love to educate women so they can make informed decisions as they transition in menopause. Now, with all the options out there, pills, patches, creams, pellets, which is the best one? And I have to be honest, the best one is going to be the one that fits you, meaning your body, your symptoms, your medical history, and of course your lifestyle. So let me break this down about each of them. So let's start with patches. Patches are something that you put on your skin that stays on there for 2 to 3 days. It gives you a steady delivery of that medication, and it bypasses the liver so you don't have to worry about any blood clots from forming. Now, some women love this. Other women, they can't tolerate it because it gives them a rash. Their skin gets a little bit super sensitive to it, or they're not absorbing it. So let's talk about pills then, especially when it comes to estrogen. This is the one that a lot of women take. Now, super convenient, right? It's very easy to pop a pill every single day with your other supplements or your other medications, but here's the deal with this. It does go through the liver. Anytime you take something orally, it has to go through the liver, which is called first pass elimination, which with estrogen, it can interfere with your clotting factors and increase your risk for clots. Now, of course, this is different from woman to woman, so you have to really evaluate the risks and benefits, whether this is something that would work for you. Then we have creams and gels. Now, these are topicals that you put on your skin every day, okay? It lasts for about 2 hours till it gets rubbed in, and a lot of women like this because it's flexible. It allows you to change the doses up, and for a lot of women, they absorb it very well. But one of the downsides to creams and gels is that sometimes women find it hard to be consistent, and also it can transfer to other humans, even children, pets, you name it. Now, there are some forms of hormones that come injectable, mostly testosterone. So this is something that you give yourself an injection at least once, sometimes twice a week, and you get those levels to go up and come back down. Of course, some women don't prefer to do any types of injections. They just don't like to, they're scared of needles, things like that. And of course, scar tissue is another thing to be concerned about too. But then there's other women who like it because it's convenient. They do it once a week, the levels go up, they feel great, and they don't have to worry about it. Now, let's talk about pellets, because there's a lot of misconceptions out there as far as I'm concerned when it comes to pellets. Pellets are bioidentical hormones that go underneath your skin, usually in your hip. It goes into your like fat tissue right there, and it delivers hormones long term. So most pellets will last for about 3.5 months, if not longer. So some women love it because it's sort of set it and forget it, and they don't have to worry about doing something daily or even weekly. Now, the misconceptions out there is that a lot of providers will say, oh, well, it's not safe because you don't know how much you're getting, and once that's in there, you can't take it out. And I do absolutely agree with them. This is why if you decide to get pellets, you have to work with a provider who is going to monitor you super close. Definitely drawing your lab work before starting on the lowest possible dose, because they can always add more pellets, and then finding where your optimized range is. Then you can spread out your lab work a little bit longer because you'll know what dose is right for you. Now, if there's a provider out there that you're seeing that's not monitoring your blood work at least every 3 to 4 months, that first year that you're doing pellets, you need to find someone else, because that's when it gets unsafe. But in my opinion, and how I treat my patients, regardless of what route you choose, any of those, I'm still monitoring you every 3 months to make sure that, number one, we're getting your hormones up to the optimized range that's going to help with symptom reduction, but also help you with disease prevention, protecting your heart, protecting your brain, protecting your bones. Problems can occur with any of these modalities, okay? If the hormones are overdosed, they're not being monitored, or they're not being individualized to you based on your medical history, your height and weight, your labs, and of course your symptoms. So in my opinion, there is not a universal best option. I think my best advice I can give you is don't go after the most trending option out there. You need to find one that's going to best suit your needs, your lifestyle, because the goal at the end of the day is finding a delivery mechanism that is going to be best for you, okay? That's going to help you feel your best and safely do that. So I hope this was helpful, but of course, if you have more questions, please drop them in the comments. And for more tips when it comes to menopause, please hit that follow button so that way we can continue going this journey together.